Good? Alright. So now we're doing the urinary catheterization of Phyllis McCracken. I've gone ahead and verified the order. The doctor has an order here for an interdwelling urinary catheter this morning and to irrigate the catheter intermittently with 30 milliliters of saline as needed. So I've got the order. I've already prepared my stuff. Got some warm soapy water here. Got a cath kit, gloves, and a few extra things. I'm good to go. Yes. Hi Phyllis, me Raymond again. Hi. I am coming on in. I'm going to shut the door. Give us privacy. Alright, Phyllis, can I just have you verify your full name and date of birth one last time for me?
Sure, Phyllis McCracken, 317XX.
Perfect, perfect. So I understand you're having some discomfort, like you can't pee.
Yeah, I feel like I need to pee, but I can't.
Alright, so I'm going to go ahead and assess your bladder real quick, see how that's pulling up. Wash my hands, putting on gloves. Phyllis, I'm going to raise your bed. Make it a little easier for me to assess you, okay?
Okay.
Great. Alrighty. So, let's take a look at your abdomen here. Alright, do you feel tender there?
Yes, oh, stop. I feel like I gotta pee.
Okay, but you're not able to pee, correct?
I keep trying, but I can't.
Alright. You are a little distended here, so we're going to see if we can treat that urinary retention by putting an interdwelling catheter. It's going to go into your bladder and it's going to drain the urine for you since you're not able to do it by yourself at this time.
Okay.
Alright, great. So I'm going to start by taking the blanket off you, just so I don't accidentally bump it or hit it. And we're going to get you positioned. So have you spread your legs, like so. There we go, very good. And first thing I'm going to do is just clean the area. So I got my soapy water and washcloths. Grab a couple. Do a quick one, up, down, or down, yeah, from top to bottom, top to bottom. Good to go. And I am going to discard these gloves. Alright, so I'm going to open my catheterization kit. Go ahead, wash my hands, grab the kit, and set it here. Not touching the inside, just the outside. Just opening it and setting it there. Alright, one more time for good measure, wash my hands. Boom. Alright, I got my sterile gloves here. Alright. Alrighty. So, I don't need that set, and I don't need that. Open this sterile rake that comes with. Grab it from the inside. And put that closer to you. There we go. And I'll put my tray here. And my specimen container I'll leave there for now. So, set this here. I'm going to go ahead and I already opened my lube, put it here in the tray. throw that in the trash. Take my catheter tip, and I'm going to go ahead and just set it right into the lube. Just let it sit there, get nice and covered. Alright, take this. I'll set that down for now. Go ahead and get my cleaning wipes ready. So open this. Get it. Alright, so that's open, ready to go. I'm just going to connect this here now. Alright. I'm going to use my non-dominant hand to spread the labia. Use the swabs. Left side. Right side. And middle. Alright, now making sure that my catheter tip is saturated about 2 or 3 inches. Hold my hand here, open wide. Using a pen light to give me a little better visual from my assistant. I'm going to grab the catheter tip and insert about 2 to 3 inches. And look for urine return, which I would see at this point. And after seeing the urine return, I would advance another 2 to 3 inches. And then inflate the balloon. Give it a little tug. And the fact that it's not coming out shows me that it is in place. So at this point, I will see urine draining down into the bag. And I'm going to secure the tube here so that it doesn't tug on her. There. Giving a little bit of slack for her to be able to move around freely, but enough so it doesn't move. Move the bag. Alright, you can go ahead and put your legs down now. Let's have you relax your legs. I'm going to get everything out of here. I'm going to go ahead and put this down on the side of the bed, on the bed rail. And I will clean everything up. There's all my stuff. Does that feel okay? Are you in any pain?
No, I feel fine.
Alright, cool. I'm going to get you covered up here. And I'm going to collect a urine specimen from down here since it's fresh. So if you want to come over here and see. Pop this out here. Open the cup. And put pressure and fill up my cup with urine. Clamp it. Close it. Close this. And I will label the specimen, the patient's name and date. Date of birth, that is. That's 3/17. Yep, 3/17 XX. I'm going to set that on the side, send it down to the lab. Put the bed in the lowest position. over to. Does that feel better?
Oh, yes. I don't feel that pressure or the need to pee anymore.
Okay, that's great. That's what we wanted. Take off my gloves. Wash my hands. And at this point, I would leave her with the call light. So she has call light right over here. Move around a little bit. Here you go, Phyllis. And I would leave. After a little bit, I'd come back, check on her. Hey, Phyllis, how you doing? Oh, I feel like I need to pee again, but I can't. And so I would look down. See, it's not draining as clearly. So I'm gonna once again wash my hands, grab my gloves while I go and shut the door. Well, I will grab my equipment before I shut the door. Raise the bed back up to my working position. I'm actually going to use this bedside table for this. I'll borrow your table, Phyllis. Okay. Alright. I will grab my solution. Doctor's order was 30 milliliters irrigation as needed. So maybe she's got like a plug up or something. It's kind of stopping that flow of urine. So I'm going to take a look again.
Okay.
And see this IV site, so I'm going to unattach it, or the urinary catheter site. Unattach it again. And I will grab alcohol wipe and wipe this port here. Pull up 30 milliliters of saline. I'm going to clamp the tube here, insert there, and I will irrigate it. Alright, and once I release pressure, I'll see the backflow of urine returning once again. So maybe there's a mucus plug, maybe there's something else that was going on, maybe a clot. So resecure the catheter to her leg and see it's flowing nice and neat again. Does that feel better?
Oh, yeah. There was the problem.
Well, we got it taken care of. So got your call light here with you again. I'm gonna put you down. Alright, so got your call light if you need me. I'm just outside with some other patients, but if you have any questions, any concerns, feel free to call me. And I will be around shortly to check on you again, okay?
Okay, sounds good.
Alright, I'm gonna wash my hands and take all my stuff out with me.